Hello from the Heartland. My name is Jenna, and this is SmartHER News. News when it matters and why it matters. Our SmartHER series features unique people who help us think and live smarter. Hi, everyone. Welcome to SmartHER News. My name is Jenna, and we have a very interesting and newsworthy topic today that's very of the moment. This is a story that has been covered over the last several weeks, even several months, but it sort of rose to the surface of the news cycle this week. And because so many of you are owners, and I don't even know if that's the right term, owners of pets, that you have pets in your household, you have pets as a member of your family. It certainly got our attention. But here's the words that will sound all too familiar for so many of us: a mysterious respiratory illness. I know we've heard those terms a lot over the last several years, but this is the first time we're really seeing it specifically related to dogs. And this is what the story is about: a mysterious respiratory illness found in dogs across many different states in America. It would be probably an over exaggeration or over emotional to call it an outbreak, although I'll ask my guest about that. We're seeing that in some cases, there are several cases of this mysterious illness in some dogs, maybe it's a grouping of some cases elsewhere. The pattern of this illness seems a little bit confusing, and there's a question about what is actually causing it. Is it a bacteria? Is it a virus? What is actually going on here? So I was looking to talk to someone that really has a great understanding of all of the different parts of this story. And I believe we found the perfect guest for many different reasons. Let me tell you a little bit about her. Her name is Dr. Lori Teller. She is a veterinarian. She's also a clinical professor at Texas A&M. She's also the immediate past president of the American Veterinary Medical Association, which is the leading nonprofit for the veterinary profession in the United States. But this is the part of her bio that really got to me. She not only has this amazing career that goes back many years, which we're going to talk about, but also this part of her bio. She married her high school sweetheart. They have one son and several pets. In her spare time, she likes to hang out with friends and family, exercise, read, travel, explore new things by day, enjoy great wine and food by night. And she's a sucker for chocolate chip cookies, corny jokes, and puppy breath. So this is Dr. Teller. We feel like we have met someone that we know, a new friend, as well as an expert. So thank you so much for taking the time to join us today.
Well, thanks for having me. I'm really happy to be here.
So tell me about your career a little bit before we get into the nitty-gritty of this particular story. I also read in your bio that you started really becoming interested in medicine at the age of 12, a veterinary medicine. Talk to me a little bit about that. How did you become first interested and pursue this profession?
So I really became interested and wanted to be a veterinarian since I was about 5 or 6 years old. And as many young girls want to do. And about the time I turned 12, my dad said, "Do you really know what veterinarians do? Because it's not playing with puppies and kitties and riding horses and doing all of those things. They get sick and you have to take care of them." And I said, "Okay." So my mom drove me to our family vet and I said, "Can I hang out with you in the summer and see what you really do?" And I was hooked. And that was it. I hung out with them every summer until I turned 16 and could get an after school job, and started working there after school and summer break. And when I graduated from veterinary school, I returned there and worked as a veterinarian for several years. So
Oh
lots
my
of
God.
fun.
And so what kind of pets are part of your family?
So right now we have two dogs and a cat, but we've had guinea pigs, we've had aquatic toads, we've had gerbils, we've had crab, we've had them all. We've done it all.
You've all right. Well, then I look forward to advice because my son actually, I was telling my family about this story last night, and my son, who's 9, turned to me and said, "Mom, does that mean we're not getting a puppy?" Because I was telling him about this respiratory illness. And I said, there might be many reasons why we won't get a puppy right now. This could be one of them, but let's ask an expert about that. So just tell me first, when did you first hear about this? We're kind of waking up to this story. But when did you first hear about this mysterious respiratory illness in dogs?
So it appears that this initially came about in a couple of different parts of the country. Oregon last summer, as well as up in New Hampshire in the New England area. Both of those parts of the country had outbreaks of mysterious respiratory illnesses in dogs. Still not even sure if they're the same illnesses, but we do know that multiple other states are now also seeing respiratory infections breaking out in various dog populations there as well.
That's so interesting. Those are on opposite parts of the country. I did that with my hands when I was thinking about the map. I mean, that's not a pattern, right? That, oh, this is just happening on the West Coast, that it was on the coast though. So what makes this different than other respiratory illnesses that you may see in a dog?
Well, from the signs and symptoms, it's really not different. They present as they would with any other respiratory illness: coughing, sneezing, runny nose, watery eyes. If it's more serious, then their appetite may be off. They may not want to play normal activity, may feel a little achy, feel warm, run a fever. But there is no way, just by looking at the signs and symptoms, to determine that this is the mysterious respiratory illness.
So one of the items that continues to come up in these reports is that while this can present as a very typical respiratory illness that we can relate to as humans as well, is that it can turn serious fairly quickly and that antibiotics don't seem to be effective. Is that accurate according to what you know of it, or how, is it, because that's one of the big questions we're getting from our audience too, which is, well, how do you tell this from a common cold to something that could be more serious that I should get some expert advice on?
And the answer is you can't. And so we will see the cases do run the gamut, and we'll see cases that where the symptoms really are mild. The dogs are still eating, they're still playing, but the cough may linger for 4 to 6 weeks. And just like sometimes we get that really annoying cough. But there are definitely cases where the dogs do take a sudden turn for the worse, like in 48, 72 hours. And they'll go from just the cough and sneezing to the not eating, to having difficulty breathing, those kinds of symptoms. And that truly does require veterinary attention. And so, what we're recommending to our clients, if your dog seems to be acting fine other than the cough or sneeze, definitely keep a closer eye. But as soon as you notice any turn for the worse, difficulty breathing, maybe the gums are turning whitish or bluish, definitely not wanting to eat or drink water, then you need to be in touch with your veterinarian.
What do you make of all of this? Just based on your past experience as a dog owner as well? Oh, on cue. Thank you very much for that.
Yes,
Who is that? Which dog was that?
that is probably Tucker, who is my large lab. And as soon as, it's the time of day when people start coming home and walking up and down the street, and apparently somebody is. So,
He's welcome. This is all part it's very real life. It's very of the moment. So, but getting back to that question, what do you make of like, now that you're seeing the press too? How urgent do you think this is for pet owners? What do you just make of the whole thing?
I'm telling people to be cautious. So don't just put your head in the sand and think that there's nothing going on out there, but also don't freak out. Most of the vast majority of dogs who contract the respiratory illness go on to recover and do just fine. If your dog is already in poor health, maybe it has an underlying autoimmune disorder, is immunosuppressed because it has cancer and is getting chemo. Maybe it has asthma, collapsing trachea, or heart disease, any of those kind of conditions, then I would be more concerned in working harder to keep my dog isolated from other dogs. But my labs, they're middle aged, they're very healthy, they're very happy, and so while I'm not rushing to the dog park, I'm not concerned about taking them for walks around the neighborhood.
So how are you navigating that? We see dogs going for walks and along, let's say, a lake or along the ocean. They're going to see other dogs. Is that okay? Where boarding your pet in an enclosed area with other dogs that also may be strangers, is that something you want to take a second thought on? What are sort of the parameters that you would give any
I
dog
think
owner?
I think it's the benefit for versus risk. I can't just stay trapped in my house all day, every day, with my dogs, or we'd all go crazy, but particularly my dogs. And certainly, if you have a young, boisterous dog who's going to become a cyclone and tear your house apart if you don't get out, you're going to have to weigh the benefits versus risk there. So that's what I'm telling people. If you have an older dog, maybe skip that walk or take a short walk and just don't let your dogs get near each other. We do know it's contagious. We don't know specifically how it is spreading. Like, do the dogs need to have direct contact, or can it be spread through the air hours later? And that piece we just don't know yet. So certainly, if you're out for a walk, try not to let your dogs sniff noses and what have you if you can avoid that. But also don't stay locked inside.
I thought it was so interesting to as I was doing research for this to see that it's not entirely clear if this is a bacteria or a virus. There are
Yeah,
some that doctors that are saying, well, if it was a virus, we would know it's a virus. It has to be a bacteria. But then you have others that are saying, well, we actually just don't know. So can they not identify what it is? Is there something that with the samples that they're taking that they can't see something specific? I don't even know what to look for. So what's
sure.
going on there where there's not clarity on that?
So we don't know, and I don't think anyone can make the assumption if it is a virus or bacteria. We do have what we call respiratory panels, and those test for the most common causes of respiratory infections in dogs, and that includes viruses and bacteria. And so nothing is regularly popping up as positive on these respiratory panels. But the flip side of that is that they're not necessarily enough respiratory panels being run. Um, Respiratory infections in dogs are not reportable diseases. If I see an infection in a dog, I don't have to call the state veterinarian and say, hey, I just had a dog present with this. It's just not required. And so the other piece of that is running the test most likely is not going to change how I treat the dog. I need to alleviate the symptoms. And if the symptoms are mild and the dog just doesn't feel good, we're going to offer supportive care. If they do get pneumonia, we know that the pneumonia most likely has a bacterial component. So at that point, we're going to start antibiotics, but we don't know if that is secondary or if that's the cause of the infection. And so we're not generally recommending antibiotics until we can determine if there's truly a bacteria that's causing it, because we don't want to create resistance either.
It sounds so familiar to COVID.
Yes, done it.
All the it really does, and thinking about, well, what about the data? How accurate is it? And we've seen that, one of the things that kind of moved this story up was an announcement that there this was present in at least 14 states. But when you
Mhm.
look at the different people, if you actually do some reporting with people that have pets, they'll tell you that they live in a state that wasn't mentioned, and
Right.
they're hearing about it in their state. So how good is the data? Could this just be, you know, a bad cold season for dogs and it's not necessarily anything different? Do we have any way of knowing that?
We don't at this time, and so I think you're definitely on the money. Um, we're seeing respiratory infections in Texas, and that's not one of the states that has been reported on that list of 14. So is it the same respiratory infection or is it not? And we really have no way of knowing. So I would encourage anybody whose dog does get sick, if you can afford the respiratory diagnostic panel, then certainly pursue it. And I understand if you can't, because it will not necessarily change our treatment plan. But it does give us information, which then helps us identify what the cause is and determine as we move forward, are there better ways to help prevent this in the future, help alleviate the symptoms quicker, and prevent the spread.
How much do those respiratory panels cost?
That depends because they're run by different laboratories, and so it truly can run the gamut from 75 to $200. The different panels also may contain different diseases, like some may just have 4 or 5, and some may have 15 different choices on it too. So a lot just depends on the laboratory that your veterinarian is working with.
We're in such an interesting time in science and learning also about how, again, how data is collected, how it's analyzed, what it looks like. And even as a journalist, what we're standing on as actually this is the information as we know it now, but we have to leave room because the picture's still developing. Could it be COVID? Would we know if it's COVID? We know COVID can exist in animals. I know Texas A&M is doing this amazing study on deer and COVID, which has been something that we've been following at Smarter News as well. Could it be, or would we know by now
We would
that it
know
was?
because we
We
can
would know.
test dogs for COVID, and they're not turning up COVID positive. So
I
most
I
likely
saw
not.
one YouTube I saw one YouTube doctor, sorry to interrupt, who was calling it Dovid. I was like, wait a minute. And then I suddenly was spiraling about which doctors to talk to. So I'm very relieved to talk to you, Dr. Keller, because I was wondering, okay. So a couple questions just from our audience before you go. What would you, when you were saying watching for symptoms, you mentioned like the discoloration in the gums.
Mhm.
Why would you watch for that? And what are the other things that you would say are a clear sign that your dog needs to be seen by a doctor?
So normally our gums are nice and pink, and that includes your dog's. So definitely take a look at your dog's gums as soon as you're done with this listening to this podcast, and make sure they're pink, and at least know what the normal color is for your dog. But if they turn whitish, purplish, bluish, then that means that your dog is not getting oxygen around the body, and that's a real concern because something is disrupting the flow, and that usually is something happening in the lungs, which means that your dog could be developing pneumonia. Other signs to watch for is real respiratory distress. So if your dog is wheezing, having a hard time inhaling or exhaling, if you can hear rattling noises in the lungs, that needs to be addressed immediately. Those kinds of things. And then, of course, if the appetite has dropped off, certainly for more than 24 hours, not drinking water, appears to be dehydrated, all of those are signs that your pet needs urgent attention.
There was a great question that we received about supplements and
Mhm.
vitamins and what can we do for our pets? Do you suggest anything? Is anything effective? And is there a seasonality to
Mhm.
this for dogs just like humans? Or
Right.
at one time there was. I know we're seeing a lot of respiratory viruses all the time now. But is there something to say, okay, we're in this particular season where we're seeing respiratory viruses. I'm going to make sure to give my dog X, Y, or Z. Is there anything like that on the market that you think is something that pet owners should consider?
I don't know of any particular supplement that's going to make a difference for this. I think the most important thing is making sure you're feeding your dog a nutritious diet. So, not too heavy on the snacks or the treats and not unbalanced. And beware, I bet a lot of your listeners do home cooked diets and things like that. A lot of times those are not well balanced. So, make sure that you are working with a nutritionist or veterinarian to make sure your dog has a balanced diet. But I think that's going to be the biggest thing at helping your dog stay healthy.
A lot of questions. I know we talked about bringing our dogs outside, but a
Mhm.
lot of questions about boarding, especially over holidays, because families have plans, they have that set up already, or also just visiting the local dog parks. A lot of dog parks are putting out alerts of saying they're going to do extra cleaning of, for example, the water bowls.
Mm.
What about those spaces? And what would you say to a family that's made plans and has the boarding set up? Are there questions they should ask the boarding, business? Or how would you navigate that part?
So, in general, I would not encourage people to cancel their holiday plans. I want everybody to get out and enjoy. Uh, Make sure your dog is vaccinated. That was the other dog.
Is
That was
it?
crazy.
This is great. I feel like this is really putting us in it. It's good.
This is my
And
life.
they see, you were saying something about vaccinations, and they were like, "Yeah, I don't like that, mom. We're not
We're
doing
gone.
the doctors."
That involves me
No
to
treats
work.
and vaccinations.
Right.
Okay, and I'm not going on vacation with my family.
Yes. So
There's a protest.
make sure your dogs are vaccinated against the respiratory infections that we can protect them from. Kennel cough, canine influenza, those kinds of things. Because sometimes, just like people, you can get infected with more than one thing. So let's prevent the things that we can prevent. Check with your boarding facility, find out what they do to prevent outbreaks of any infection, including this respiratory disease that is going around. And if they happen to have an outbreak, how are they containing it? What are they doing to isolate the dog or dogs that are showing signs? And how are they preventing that from spreading until you get back home and can pick your dog up? Those are going to be the main things that you can do. If your dog is at higher risk, some of those things that we talked about earlier, as far as underlying respiratory diseases or immunosuppression, maybe a pet sitter is a better choice if you can arrange that. That may be a better idea, whether that's a neighbor or a professional pet sitter or a good friend who can come and check on your dog or take care of your dog in its own home. That's certainly an option. And then, depending on what your vacation plans are, and if your dog is at higher risk, can your dog go with you? Is it possible to tweak your plans to make that happen? So, those are all things to consider, and it's going to really come down to what your plans are and what your dog's current health status is. And so, that's what I'm telling my clients.
That's a really great question about, well, what happens if there's a dog that suddenly looks like they have a respiratory infection a couple days in? Here's our plan to isolate this dog or care for this dog. That's a really good tip. When you're talking about higher risk, I know you mentioned some diseases, but does that also include older dogs? It's older dogs as well as dogs with pre-existing conditions?
So if it's an older dog that's otherwise healthy, I wouldn't say age alone is the barrier. But the other thing that we do think about is our brachycephalic dogs. So those are the ones with the smushed in faces, like French bulldogs and pugs and English bulldogs, that are all really cute and we all want to snuggle with. But they also, by how they are built, have compromised respiratory systems just as part of who they are. And so that does put them at higher risk as well. And so that is something else to keep in mind. Just know that your dog may be at higher risk. It's harder for them to clear respiratory infections, and they already have a harder time getting oxygen to where it needs to be.
What is the question that you're most looking to have answered about all of this?
Well, what I want to know is, what is it? What is
Yeah.
it? How do I prevent it? And what is the most effective treatment for it, especially for these dogs that seem to have more serious signs and symptoms?
And those symptoms that are lasting 6, 8 weeks or, several months, and you can imagine it doesn't feel good after 10 days of being sick. If
Right.
you're sick for 2 months with a cough, what just a final question here, because we're living as families,
Mm.
do you see there being the potential that this is coming from humans to dogs, or that it could be passed from dogs to humans? Or that was one of the big realizations during COVID, quite frankly, was
Yeah.
that time where suddenly it was, oh, pets can get COVID. Oh, there's zoo animals that are getting COVID. And it was this very interesting part of the story that meant, for someone, again, that doesn't have your background, also is not a pet owner, didn't even really think about that. My pet could get a cold, let alone the flu or something like that.
Right.
So is that still in the discussions that you're seeing, or is it seem, no, this is really isolated to
So
the pets?
we are not aware of any other species, whether that's humans or cats or other animals that may live in the household, getting this infection. As you said, we didn't know for a long time that dogs and cats could get COVID either. So, and they were certainly more resistant than we are, but they could still get it. So at this point, we have not heard of any cases of it being spread to humans or cats or coming from them either. Um, but it's something that we definitely keep an eye out on all the time.
And that's also a really important highlight from our conversation about the data, about how it's being reported and what's required is so different depending on where you are or what it looks like. Is there anything, just as we close here, doctor, that based on the last several years and so much conversation about respiratory illnesses in humans, that has changed the approach in veterinary medicine about how we're approaching our pets? Did we learn anything from the last several years that you think is actually being applied here in a positive way?
There is a lot of translational medicine between humans and dogs in particular, and that goes both ways. A lot of studies are done on sick dogs, including cancer, not just respiratory illness, and how we diagnose and treat those then translates to what's happening in humans. And I think we did learn a lot from COVID and developed better diagnostic testing. Unfortunately, we still don't have a diagnosis on this one, but I think we have better technology and better processes so that we will get there and we will figure out what's going on with this round two.
Even just the term respiratory panel. That's
Yeah,
something that I had never heard over the last couple of years. Now it's something you could actually ask your doctor if you're getting treated or your child's getting treated. So it's sometimes hard to take a step back and say, okay, we actually learned something here, especially when we're still trying to sift through so much information. Well, this is definitely a story we're going to watch. I appreciated your time, Dr. Teller, and the time of Tucker. And who was the other one? There was one that
Gracie,
wandered in. I think that Tucker and
Gracie.
Gracie.
Yes.
So I appreciate, please thank them on our behalf as well for their contributions, making it a real life.
There
We
you go.
appreciate it, and we'll stay close to see what happens next. But thank you so much for your time. I really appreciate it.
Sure, sounds great. Y'all have a wonderful holiday.
Quick, concise, nonpartisan, smarter news, a refuge from the storm. I'm Jenna. Thank you for choosing smarter.